At Premier Formulas, we provide only the highest quality prescription-grade vitamins and supplements.
Hey guys, Dr. Mike Freedman here. So I already did a video on pulmonary herbs for wet productive coughs, and today I'm going to do a video on pulmonary herbs for dry coughs. So I have 4 of the more common herbs used for this issue up here on the board. The first one we have, which you'll find in almost every mixed lung or cough formula, herbal formula, is prunus or wild cherry. The actions of prunus are antitussive, so that will actually, stop you from coughing. It decreases the amount of coughing. It's also a relaxing expectorant, so it will also, a lot of these herbs have overlapping actions, so it's kind of the art form of being an herbalist or creating an herbal formula for a specific patient or yourself, is mixing these herbs together with different actions that overlap. So, some of these herbs that that I'll talk about being for a dry cough are also used for wet productive coughs and vice versa. So there's lots of overlapping, and it's just, playing with the herbs and seeing what you respond best to. So again, prunus, antitussive, will prevent some coughing, relaxing expectorant. That's, again, we talked about expectorant herbs in the wet section. So this will also adds a little bit of water to the lungs, so it thins the mucus production, which isn't really a problem for dry coughs. But also astringent properties are also commonly used for wet productive coughs. It tightens the tissues up. It could help if you have like bleeding in a dry cough. If you have a dry cough which is very abrasive and is causing some irritation in the tissues, and the astringent will kind of firm up those tissues and actually stop some of that bleeding. So it's good for both dry and wet coughs. The dose on this herb is 3 to 5 milliliters 3 times a day. So it's a a high dose herb. It's only has really a little bit of nausea, and if you exceed that dose by too much. So not a lot of safety side effects there. The second one is verbascum or mullein. A lot of times you'll see this one in oil you put in your ears. This is not what I'm talking about today. This is just the extraction that you'll use here. So the actions on verbascum are it's a demulcent, so it's a soothing herb. It'll coat the tissues and provide some comfort. It's antispasmodic for those spasming dry coughs. And again, a mixed expectorant. Doses, it's a high dose herb, 2 to 5 milliliters 3 times a day, and no safety precautions on this one either. The third one is tesselago or colt's foot. Tesselago is also demulcent, so it will soothe the tissues in the lungs, a relaxing expectorant again. It will thin any mucus that might be there that you probably won't have in a dry cough, but it's antispasmodic, so again, it will calm down that spasming of the lung tissue. The dose, it's 2 to 5 milliliters, and this one 3 times a day. And this one does have some safety issues, so it's contraindicated in pregnancy and lactation. It's contraindicated in patients with liver disease, and so it's contraindicated in those patients because it has some alkaloids in it. Alkaloids it's a chemical produced in a plant for the purpose of providing protection from insects, so the insects don't eat the plant. But these things are in there and they can affect humans a little bit too. So we say no pregnancy, lactation, no liver disease patients, and use it short term because of the alkaloids. And then the last one is Grindelia or gumweed. The actions are it's an antispasmodic, it's a bronchodilator, so this will open up the airways in the lungs, allow you to breathe a little bit easier with that decreased spasming. Again, relaxing expectorant, and this one's also a mucolytic. If you wanted to use this for wet coughs as well, it will help allow you to cough up some of that mucus and thin that out as well. Dose is 2 to 5 milliliters 3 times a day, and Grindelia gumweed is another safe herb, so no side effects to worry about there. I didn't talk about this in the last video, but you can obviously mix these together. They have similar actions, overlapping actions, and synergistic effects because of those actions. So if you want to mix some of these together, say you like the astringent properties in wild cherry and the bronchodilator properties in gumweed, then you don't need to keep the dose, 5 milliliters for prunus and 5 milliliters for gumweed 3 times a day. You can decrease that down, maybe do 3 milliliters of this and 2 milliliters of that mixed together in your bottle, and give yourself a nice, mixed herbal formula for yourself. I think that's about it. Again, a lot of these are found in the pre-made formulas, but if you want to tinker around and try to make your own combination, or just you like one of these herbs in particular, these are 4 that I think would be really good for dry coughs, and even some properties for wet coughs. So with that, have fun, be careful, and thanks for watching. Bye.